And we have questions for anyone on the panel, please.
Just a couple things to clarify. The 500 million masks the president mentioned that are being developed, are those for healthcare workers, or are you planning to actually hand out masks to the American public?
I think the focus has been to make sure that our healthcare workers and our healthcare system has the supply. And with regard to what we're gathering from literally around the world, and from manufacturers in the United States is first being deployed to states and to hospital systems. But I must tell you that whether it be the Haynes Company or other companies, we're seeing manufacturers in America that are recognizing the growing demand for masks by the American people, and are spinning up production literally by the hour. But our focus, our continuing focus, is on making sure that healthcare workers have the personal protective equipment to do their jobs safely and provide the level of care that every one of us would want.
Thank you, Mr. Vice President. Kansas Governor Laura Kelly says that she has put in 7 requests to FEMA for supplies from the stockpile, and those have not been fulfilled. So will Kansas be getting any of the ventilators, because the request included ventilators? And does she need to be calling the White House instead? Have you spoken with her directly?
I've not spoken to the governor directly, but I'll reach out this evening, certainly. In our conference call with governors this week, we spoke to them about the approach that we are taking. Traditionally, governors are accustomed to when a hurricane strikes the Gulf Coast, when wildfires strike out west, when flooding or tornadoes hit in places like Indiana. You're accustomed to have a declaration of emergency approved, and then resources flow from FEMA. In this situation, as we deal with a nationwide declaration and an epidemic, what we've explained to governors is that what President Trump has directed is that we leave no stone unturned to find resources around the country and around the world, including ventilators, and we make sure as the coronavirus epidemic impacts individual areas, that the healthcare workers and the families and the patients impacted have what they need when they need it. And what I would say to the people of Kansas is that we're looking at their numbers every day, just as in the case of every state in the country, and we're going to work our hearts out to make sure that as the coronavirus cases emerge, and we hope that through the great work that Kansas has done on social distancing and mitigation, the people of Kansas have done a remarkable job, that we may well be to a place where their existing resources and capacities are present. But we want people to know that taking the counsel of Dr. Birx and our entire healthcare team, we're focusing, just as we did first in Seattle, California, and now in New York, New Jersey, Connecticut, Louisiana, the Detroit area, the Chicago area. We're going to make sure that those resources go in that order.
And so, because you brought up social distancing and the work that Kansas has done, there's actually a controversy right now over her order to limit the number of people in religious gatherings to 10 people. Should states be telling religious institutions how many people can gather if it's to stop the spread of the coronavirus?
Well, the President's coronavirus guidelines for America ask every American to avoid any gathering of more than 10 people. And that's on the advice of all of our best scientific experts as a way that we can slow the spread. But as we've made clear to every governor, we defer to our governors in what they believe is the best and appropriate practice in their states, and we'll support those local decisions. Yes, please.
Thank you. In his opening statement, the president said there were 10 drugs that are now in clinical trials. Would hydroxychloroquine be one of those?
Well, I can speak to that, and then I'll invite Dr. Birx, Dr. Fauci to come forward. We do have, I believe, we will have roughly 4 separate clinical trials underway studying hydroxychloroquine. But it's important to remember that as the President's made the point many times, the FDA has approved what's called off-label use. And so in consulting with your physician, if your physician determines it's appropriate to write a prescription for hydrochloroquine, we're working today to make that available across the country. It's broadly available today as an anti-malaria medication, but we're working around the country and internationally to increase that supply. But we are studying it in at least 4 different clinical trials, and Dr. Fauci
Yeah.
can speak to that.
So thank you for that question. The easiest way to find out is to just go clinicaltrials.gov, and it will tell you everything that's there. There are a number of different clinical trials, some of which are randomized controlled trials, which, as I've said many times from this podium, to me is the optimal way to determine ultimately if something is safe and effective and works. But there are a lot of different ways that that's being looked at. It's being looked at against the placebo. It's being part of a multi-arm trial, comparing it with others. There's a trial that was recently started, actually in prophylaxis among healthcare workers. So there are several of these. In addition to that, there's what was just mentioned now, that any physician, in consultation with their patient and back and forth, can make the decision to use the drug on an off-label. So we have 2 things that are simultaneously going on. We're having actual formal clinical trials and the off-label use.
Very good. Next, please.
I want to turn back to the disproportionate rates of Black deaths when it comes to the coronavirus. Dr. Fauci, you have been talking about this for weeks, that there are underlying health issues. People with underlying health issues are most at risk. But if we knew that Blacks disproportionately have fallen into that category, why wasn't the CDC prepared to gather this data in real time to work to fight this?
Well, I'm not sure, but we have the director of the CDC here who could answer that question, but let me try to just take it from a different perspective. The health disparities that exist are not anything that started with coronavirus. They were there. So there isn't much you can do about the disparity. The thing you can do is to make an extra special effort to protect people who have the underlying conditions. So it's the same way as we say, well, the elderly and those with underlying condition. Unfortunately, the African American community has a much greater proportion, population for population, of these underlying conditions. So the best weapon we have right now is what I said in my opening remarks, is to do whatever we can to get them to realize that what we need to do is to protect them from getting infected, and to also protect them from inadvertently and innocently bringing the infection to people who have these underlying conditions.
That's a good answer. Yeah, please.
Thank you, sir. Can you explain the thinking behind these 100 ventilators that were given to Colorado when other states like Kansas have had trouble getting ventilators? And can you say whether a personal relationship with the president is helping states like Colorado get these ventilators? I mean, there are 15 states that have more cases than Colorado.
Well, what I can say is that we've been watching Denver very closely, and like many of the other key areas that I touched on, we're beginning to see some encouraging news, but in our interactions with the governor and with local officials and with the senator, we've made an effort not only in Colorado but around the country to be particularly responsive to states where we've seen a growth in cases. But I'm going to let Dr. Burke speak to that as well. There's literally beginning with New York, New Jersey, Connecticut, Louisiana, the Detroit area in Michigan, the Chicago area. There's a series of other cities, including Denver, that we've been watching very carefully. And while we're beginning to see some encouraging news, we want healthcare workers in those communities to know for certain that we're going to move resources into those areas where we see significant outbreak.
Can you just address the point about whether individual governors with relationships with the president are getting preferential treatment?
I can tell you within that decision complex is not just the absolute number of cases, it's the hospital capacity and what each of those hospitals have. So remember, I think a couple of days ago we talked about how the states are sending the information about ICU beds, hospital beds, ventilator needs. So different states have different, which I don't think any of us probably knew before this, but there are some states that have lots of ventilators, and there's other states that proportion to their population or by their cases of COVID have less. And so I'm sure Denver and Colorado fit into that model where there were hospitals that had less ventilators proportionally and were needed for the cases that were seen. So that's the kind of analysis. So every state that has a few cases more than Colorado have all received ventilators except for, I think, Texas, and that's just because they are just starting. Remember, Colorado was one early on the curve, so they have many more people have moved through that progress and are in need of ventilators. Texas is very early in their curve in both Dallas and Houston. So that's what I was talking about. Each of these are a micro curve that we have to follow independently, or we would be making general decisions rather than specific decisions by geography.
Mr. Vice President, a follow-up on the church's question. You're obviously a very religious man. Will you be going to church on Sunday?
We'll be attending church right in the living room at the Vice President's residence, where we've been attending for the last several weeks. The advantage is we get to go to our home church in Indiana.
Is that the same example you'd like to see churches around the country, regardless of what governors are saying, do as well?
Well, I think the President's coronavirus guidelines for America are very clear, that during this 30 days, we're calling on every American in every state, first to listen to your state and local authorities, but right after that, to avoid gatherings of more than 10 people, avoid unnecessary travel, use drive-through at restaurant instead of going into the restaurant. We are, as these health experts have told you, seeing real evidence that we're slowing the spread, that these mitigation efforts are having a strong impact. And tonight, as many people, even at this hour on the East Coast, are beginning to sit down to a Seder dinner. It's the beginning of Passover, and with Easter celebrations this Sunday. We just want to encourage every American to heed the counsel of the guidelines, put those into effect, and know that in so doing, we'll hasten the day. We'll hasten the day that we put the coronavirus in the past and we reopen our country.
Mr. Vice President, last question. Can I ask a question of Dr. Birch or Dr. Fauci?
Of course.
As you are both probably aware, there's a lot of misinformation, conspiracy theories out there about the coronavirus. There are some commentators who are suggesting that the number of dead are being inflated because they're saying that people who are dying with other issues are being listed as COVID-19 deaths. Perhaps you've seen some of this commentary. You may be too busy to see it, but it is out there. What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded? For example, somebody who might die from a number of factors but had coronavirus are being listed as coronavirus deaths, and because of that, the number is being inflated.
That's a fair question.
Yeah.
And you might also speak about the converse.
Yeah, we've been hearing the converse too. That we've been hearing both sides of that. I think we've made it very clear. I think every time I've been up here about the comorbidities, and so most of the people, and we talked about the Italy data. The majority of the Italians who succumbed to this had 3 or more comorbidities. So this has been known from the beginning. So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having that underlying condition and getting this virus, we know, is particularly damaging to those individuals. We don't know all the pathophysiology. I wish we did right now. We see a lot of vasculitis, where Tony and I came from. Dr. Fauci started in the vasculitides and Wegener's. So, these are things we have studied for a long time. We are trying to understand the pathophysiology, but what we can tell you at this moment, if you have asthma, if you have renal disease, if you have diabetes, if you have hypertension, These are pre-existing conditions that put you at a greater risk to having a worse outcome.
So, Jim, just to add a comment to that, because, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Dr. Brooks, you said something about not enough tests being performed because some of the labs, the machines aren't running. Did you want to clarify that? What did you mean by 80% weren't running?
So I have a call with them at 8 p.m. tonight. Every single one of those 120 laboratories, I think 87 of the laboratory directors have confirmed that call. It has to do with a machine called an Abbott M2000. It's a very high throughput machine. We have 1 million tests out there. I made a big push, and Abbott was extraordinary about getting those out to the labs. I mean, this is not sitting in a warehouse. These are physically in these laboratories, sitting there right now.
The machines aren't running.
They're not running. So we've only run 88,000 tests in 3 weeks off of those machines with 1 million test kits. So as someone who has worked in a lot of laboratories, to have a machine that is needed, because we could have screened every healthcare worker. These machines are every place in the country. So they could have screened in these last 3 weeks 100% of the healthcare workers across the country that needed these tests to be done, and they're high throughput. So I have a call with them at 8 o'clock to really talk about.
Can that to happen? Can an order be given?
Well, I asked the vice president to give me a chance to talk to my colleagues first, but we have a call with the CEOs of those hospitals tomorrow.
Thank you. That's a really important question, and it underscores the fact that Dr. Birx pointed out, that with this new test, Abbott Laboratories, FEMA's been busy distributing to states around the country. We purchased 1,200 of these machines to be able to do these tests, but there's 18,000 all across America. And so let me just renew our call to all the hospital administrators and lab operators around America to go and identify those Abbott Laboratories machines, and know that while we've already tested more than 1.9 million Americans, our short-term objective is to test as many Americans as possible as we see the coronavirus epidemic emerge in areas around the country. We want to surge those resources. We want states that haven't seen a significant outbreak to have access to that 15-minute test. And ultimately, as we go forward, I think President Trump said today, nobody wants to open the country up more than him, and I can attest to that. But we're going to open it up when we can do so responsibly, putting the health of America first, and to reopen America and to stay open America. We're working around the clock to continually expand the kind of testing that will allow us to do what these experts call surveillance, so that in every state in the country, once we put this chapter of coronavirus behind us, we hope and trust sooner rather than later that when next fall comes, that we will have a vast array so that CDC can do what it does so well. And that is, when a particular disease emerges, CDC surges personnel, does contact tracing, isolates that individual. So we're just really calling on all of our partners in the laboratories and in hospitals around the country to identify those Abbott Laboratory machines and help us continue to scale up and expand testing. But to every American, let me again just say thank you. Thank you for what you're doing. We are in the midst of a week of heartache, and I want to assure every American who has suffered loss that we're with you. We're praying for you and your families, and And we'll continue to work our hearts out to make sure these incredible healthcare workers who are inspiring every single one of us all across the country every day have the resources and the support and the equipment to do their job safely, to provide the level of care that any American family would want for their loved one, and to be able to go home safely to their families. And the key to all of that, the key for the next 22 days is 30 days to slow the spread. And I just encourage every American, if you haven't done so recently, go to coronavirus.gov, print off your own copy, pick up the phone and call a friend and just tell them that you heard from the experts, you heard from the president and our team that we're beginning to see glimmers of hope. Extraordinary progress in California and Washington is a tribute to the people of those states and the leadership of those states. But the beginning of stabilization and perhaps even leveling in New York and New Jersey, Louisiana, and Detroit is a testament to the people of those communities, to the leadership of those states. But understand that every one of us has a role to play to protect the most vulnerable among us and to save lives by putting the guidelines into practice, just like you've been doing every day since they were first announced. So thank you all, and we'll see you tomorrow.